2020, begin with the flag salute. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
You got a chance to look over the previous meeting's minutes, any changes?
Mr. Chairman, I'll move we accept the minutes from the previous meeting. Second.
Aye. Moving on, signing the motions.
We have several motions from the last meeting to sign. The first motion is 20-397, that the consent agenda be approved. The second motion is 20-398, to recess this open session and go into a closed executive session for a period of not more than 15 minutes to discuss items that would be deemed privileged in the attorney-client relationship, to discuss the Jayhawk Wind Farm, and to include the Board of County Commissioners and County Councilor Jim Emerson, and to reconvene by 10:27 a.m. The next motion is 20-399, to authorize County Councilor Jim Emerson to sign the Jayhawk Wind Development Regulations in Crawford County, Kansas, lead. The next motion is 20-400, to approve the request from Jayhawk Wind for the expansion of boundaries for the Crawford County project. The next motion is 20-401, to recess this open session and go into a closed executive session for a period of not more than 15 minutes to discuss items that would be deemed privileged in the attorney-client relationship, to discuss a health department contract, and to include the Board of County Commissioners and County Councilor Jim Anderson, and to reconvene by 10:40 a.m. And the last motion is 20-402, to recess this open session and go into a closed executive session for a period of not more than 15 minutes to discuss items that would be deemed privileged in the attorney-client relationship, to discuss a potential health department contract, and to include the Board of County Commissioners and County Councilor Jim Emerson, and to reconvene by 10:51 a.m.
Okay, thank you.
Thank you. Thank you, Donald.
Thank you, Commissioner.
All right. I guess moving on. Dr.
Good morning,
Simmons.
Doc.
Morning. Goes up there. I don't know if anybody else wants.
Thank you.
Good morning, Commissioners. Talk about our current state. I'm going to start with our health meeting, health coalition meeting this morning. Via Christi, 2 positives and 2 PUIs with no vents. Girard, 0 positives, 0 PUIs. Gerard has plenty of capacity. Via Christi we're calling it 25% capacity now on your gating criteria. They were at 15% this morning. That's capacity available with discharges today, so that will open up some. And we're at 98% staffing. So the hospitals are doing okay. PSU is down to 8 in isolation that they know of, which is good. That's a much better number.
What do you mean that they know of?
And I was going to get to that in a little bit.
Okay, no, yeah, that's fine.
And so they have 8 currently right now that have tested positive and are in isolation. I have some concerns about that. Some in the community are avoiding testing to avoid isolation. That's what I'll get to. So our weekly incidence rate, currently we have 62 cases. Now again, that's Sunday through Saturday. So we still have 2 days of data to collect for the full week. Although we don't anticipate that will be 40 cases, so we should be down again this week over last week, which was down from the week before. So that's a good trend in our opinion, and shows improvement. We are still, we would be considered in the red just due to the case rate as they would look at it, as KDHE would look at it. Percent positive will be pending. It's going to be around 10%. The age breakdown, I will highlight the fact that we have switched certainly out of the younger category to where we were 85+% in the younger category. Now we're 2/3 in greater than 25-year-olds, or 25 and greater. 2/3 of our cases are there. That is somewhat concerning to us, again, because that's the population that is more likely to become sicker in the future. Currently, we have the capacity to handle that, which is good. Number in isolation, total cases 168, and we have 672 in quarantine. The total deaths, 8 is what we're at this week. We have adequate testing capability. KDHE is still assisting us with isolation and quarantine. Janice is going to talk to you later about consideration for more epi nurses locally, and I would strongly encourage you to consider that recommendation as it allows us to continue to handle this all locally, which would benefit us overall, both in information gathering and management of this in our community. The overall community impact we still are considering as moderate because of the number of cases that we have and our concerns with respect to the age groups that the cases are presenting in. We still have adequate capacity, but we want to monitor that closely, so moderate impact. School gating criteria, on the other hand, you will see as we look just at the schools, we are doing, we believe, very well with 4 new cases in each of the age groups listed, stable trend, and our isolation number is 11 and 292 for quarantine, and that is staying fairly stable. So we believe the overall school K through 12 impact is low, and we're continuing to follow that. We've worked closely with all of the school nurses and administrators since our last conversation, continuing on the direction that we're going, and we feel that relationship is still solid and strong. Concerns going forward, I will start with the question that you had asked. I do have concerns that there are those in the community that are avoiding testing to avoid isolation and quarantine. We know of a few cases and we're working through those. What everybody needs to understand is if we know of that case, we have the authority to direct isolation. and quarantine and will in protection of the community. And we have to do that, right?
Even without a positive test?
I have to have concerns, right? And that's what the statute says. If there is concerns about communicable disease that's listed, then we have the authority to direct isolation and quarantine and testing. Now, I'm not going to force somebody to take a swab up their nose. But if you are sick and decide not to do testing, we're going to consider you COVID and direct isolation.
Well, and actually CDC and all, of the recommending agencies do say if you have symptoms consistent with COVID, which we know is a whole list of things, and choose not to test, then the return to work, return to school is 10 days symptom-free and 72 hours fever-free. And early on, all of our negative tests, that was the recommended release regardless of a negative test. It was still, because we couldn't completely rule it out. And so that is the recommendation with CDC and all of the public health agencies across the country say if you choose not to test and you've got COVID symptoms, then it's 10 days and 72 or 24 hours according to CDC, but we're still.
KDH is, 72 hours.
So what does discovery of those instances look like? Like, is it somebody going into the doctor, they're sick, and refuse or say they don't want to take a COVID test? Or like, how does that shake out?
So, workplace, school place, arriving sick, and then deciding not to get tested.
And that's part of the screening that the schools are doing to identify people to keep sick people out of
Right.
school. If you find a child or a staff with fever and then they choose not to test, then it is, according to, the regulations, it is 10 days.
And we're seeing that in the college population
Right.
as well.
Yeah.
So they're staying home
Or not staying.
or not staying home, unfortunately.
Right.
And so we just want it to be known that we have the authority to direct isolation and quarantine and will, if we need to, in those cases. And we've talked to the appropriate agencies, and mainly that's the schools and college, and we'll do that if needed.
And we're not, we aren't encouraging the testing. I know it could be misunderstood that we're trying to get more tests and all of that, but in actuality, the more tests that we have, the more negatives we have, and then people can return in a much quicker time period. And so, I think the importance of the testing in symptomatic, and we still really
It's symptomatic.
are advocating for symptomatic testing, not asymptomatic testing. It would return a lot of people sooner. And earlier, because initially it was, even negative tests, it was the same 10 days and 72 hours. And it was probably about June or July that there's really not a black and white, this is the time frame that you can return people. And so, we decided that in order to get people back to work sooner, and if they're average risk for COVID, meaning they're not living with someone that has COVID, or they don't have loss of taste and smell, which is a very specific feature of COVID, then they're considered average risk. We can get them back sooner if they have a negative test. And so
We do encourage, we just really, the bottom line in this conversation is if you are ill, you should be seen by a medical professional. Now, it may just be something, allergies or strep throat or flu or something wholly different. With our kids, we have, ear infections going around right now because of the allergies and things back up, and then they get
strep throat.
and strep throat. And so if we can see them as medical professionals, we can make that decision and maybe not impact them significantly. In the undifferentiated, though, we have to go to the greatest good, and that would be the isolation. And, we just don't want to get there. Just go get seen, right? Don't try to gut this out and hope for the best, because You know, and on these kids, the 0 to 25-year-olds, they're not going to be significantly impacted. That's not the person that they're going to harm. It's not themselves. It's the other contacts. And that's the piece that we're trying to break. Trying to break that chain of transmission to those that are higher risk. And so we just wanted to say it here for two reasons. One, so they hear, and two, so you guys understand which direction we're going on that as well, in case you get the calls. We've got to look at the greater good and the safety of the community and will, right? But it doesn't need to happen. If you're sick, get checked, and we'll move forward from there, right? And may find things that you didn't know that you had and can fix those.
So I did have a couple of questions. So as far as, because I know like the avoidance, people avoiding going to the doctor for a variety of reasons, like both I don't want to test positive for COVID, so I just won't get tested, but also I think like maybe fears of like going into a health clinic where there's potential exposure, a fear of potential exposure. Do we know what our like rates of people being seen look like compared to previous? I don't know that you can compare it previously because we're in a pandemic, but
yeah, and I think in both of our industries, there was a time that we were down less than 50% or more than 50% of what we had typically seen. So our average day in the emergency department in January was 44 per day. In May, it was 20, right? And so we are back up into the high 30s, even low 40s. In the emergency department, I think the clinics are...
I think we are still at about probably 80% of what we anticipated based on last year's data. But also keep in mind that a lot of outpatient and even emergency room, we are set up structurally different this year compared to last year, because we are screening for possible COVID, and then with fever and respiratory symptoms, we actually
There's a whole different flow pattern.
we direct patients to do a curbside visit. So they aren't even coming into the clinic. They're still being evaluated and treated and can see a provider. And if needed to come into the clinic to get a chest x-ray or something, then precautions are taken to minimize exposure.
And that really needs to be, I don't want to overstate it, I don't want to understate it. I want the public to know, we want the public to know, every medical entity in the community has mitigated,
Yes.
so that we don't have spread within our waiting rooms or within our facilities.
Right.
And so if you're sick, for whatever reason, if you're having a heart attack, don't
Right.
not go to the emergency department because you're worried about COVID.
And don't not go for your diabetes because you're worried
Yes.
about it, because that's the next pandemic that we're going to see is uncontrolled chronic disease.
And we are seeing
And
it.
we are seeing that
Yeah, and-
because people have delayed care for their other issues. So we definitely don't want that concern to keep people from seeking care. There's also, most places are still doing virtual visits if needed. So I would definitely recommend that patients that may have concerns is to talk with, when they're scheduling their appointment, and find out what is in place to kind of relay their anxiety about it. Because, I think the majority of healthcare providers are doing accommodations to make sure people are seen.
Ground zero for the mitigation strategy is the health entities, right? So that's where it all started
Right.
as far as mitigation, and they've had months and months of practice, and so they're good at what they're doing. Don't fear that aspect and overlook the chronic aspect, because in the emergency department, what we're seeing right now is unresolved chronic disease or untreated chronic disease for the last 6 months, and it's severe, and it doesn't have to be. Don't fear the medical entity with respect to COVID. Fear your chronic disease and not taking care of it.
this is maybe a question bigger than the scope that we have control over, but do we have a sense of like the impact that the number of uninsured, which I'm sure is fairly large in our community, consistent with our not great health outcomes, the impact that that's had on people being willing to go and get seen?
I don't think it has had a significant impact because there is a solution for people that are uninsured as far as seeking health care, and that hasn't changed.
Yeah, and we're both part of those solutions.
Right.
And so it's probably weighing on the mind of some, for sure. That being said, we're open, they're open, we're there. We'll figure out that detail later. But undoubtedly, there's some concern related to that, no doubt. But it doesn't have to be. We've had these systems in place for
17 years.
yeah, and
Less.
110 years. So, you know, that's available out there. The other things that we wanted to talk to you about, two other things. One, the nursing homes, long-term care facilities, we're going to add that information to the gates for you so you can understand where we're at on that.
Yeah, I've had several calls pertaining to people wanting to see their loved ones
Yep.
in the nursing homes.
So, two things with that. One, CMS just put out guidance regarding visitation. It's based on community impact. We're still at a moderate community impact, so that does affect visitation. We are, by that guideline, working to open up visitation, at least on the outside visits with barrier mitigation, to allow for family interaction. We know it's important. As medical professionals, we know it's important, it's needed, but we need to do it safely. The inside visits, we can't really safely open up yet. And that also follows the CMS guidelines. We do have a challenge with the CMS visitation policy because KDADS, the Kansas Department of Aging and Disability, they have a set of criteria. CMS says we're in charge, KDAD says we're in charge, and in the background we have KDHE that's also playing in the picture. And so, and then us, locally. So we talked with all of the long-term care facilities. Well, I think all of them are represented at this. They're on our health call Monday, Wednesday, and Friday. So we've taken the steps that we've opened up one, and there'll be a second one open that will allow for admissions. We have a couple that are opening to the outside visits currently, which will help, Commissioner Moody, with respect to your question. Where they're all going to submit their plans so that we can have that at least evaluated so they can do the outside visits for right now with their plan for the inside visits when that becomes available. And we'll work through that. But that's one of the reasons why we want to add this, so when your constituents call and say, hey, I can't see mom in the nursing home, you can say, yep, we know, we're looking at that. You can see them outside. You can, right now we have 4 facilities that have positive either residents or staff.
Oh, geez.
And
Yikes.
the number's not big, but it's there. And so we have to protect
Sure.
the residents, because that is that population is the single highest rate of injury and death, right? And accounts for half of our deaths. So we want to do the right thing there. But we want to do the right thing also with visitation and allowing them to open, because they're dwindling because they can't see their family.
So it's kind of an ongoing chain, because we talk about, so what's going on in the community is going to impact the nursing homes because of the staff. So if they are coming in contact with people that are positive and choosing not to be tested and continue to be out and about, and then risk them, and they become positive, then that affects the nursing home and that affects the visitation. So it's this chain reaction, which is why, again, we get back to the importance of doing all that we're doing as a community to get where we need to be so that we can have the nursing homes open and all of that.
And this brings up the last issue that I had, and that was with respect to KDHE is putting out the information for outbreaks throughout the state. They're doing that for a variety of reasons. They're trying to give data to people, and I think that's appropriate. The data is somewhat challenged at times. In fact, we recently had one where they had listed an outbreak in one of our schools, which was not right, but it's the way that KDHE actually put it into their EpiTrack system. It had the family associated with the school when it wasn't, there was only 3 and it was listing at 9. And so it's not coming through. And so that creates some consternation with whoever sees that to say that we are not reporting right, or the school's not, given the appropriate information.
And it creates not a confidence in the data.
Right. So our answer to this is KDHE is putting out their data. That's fine. If you have questions regarding that data, please see KDHE. We know exactly by school, by number, by student, exactly what we have in each and every institution for isolation and quarantine. And we will follow that. We are putting out the information appropriately. We are managing it appropriately, and we are working as a team throughout the community to make sure all of that is done. And so there may be some questions on that and reasons why, different reasons why they put that out. And we're not going to get into that. What we know is what we have, and we are managing that appropriately, and that's our answer to that question.
And we do look frequently at the KDHE data and are familiar with what is out there, and even include some of it in our gating criteria, because really the only way for us to get the % positive rate is from there, because there's so many different entities testing to know how many tests and all of that, which is why, I have this in italics that it is pending, because I'm updating 2 weeks ago on here as KDHE updates their website. So it is that lag in data that is the most challenging. I think ultimately it's going to be accurate, but there's such a lag in just getting the correct reporting in, and then, EpiTrack's labeling it correctly and all of that. So we are looking at that, but we are looking at that knowing what locally our true data is.
And that's the important bottom line is, if we weren't able to present the local data with the local numbers, then that would be a problem. But we are and do.
And I think that, to Dr. Stebbins' point, part of the reason that they put that out there is because there are communities that are relying solely on that information, and if they don't put it out, then they don't have it. And so, which is difficult, because then you're making decisions on things that are not complete. But I think it just helps us appreciate,
There's also communities that are not embracing any mitigation. And there's a lot of outbreaks in those communities, and that outbreak list shows. We were kind of unintended consequence, I think, in some of our, what was shown in our data, the school, community health.
and they were very responsive when we.
They did, they fixed it.
Yes. We pointed out what, the concern was, and they were very responsive to fix that.
So right now we're doing well. We have had no current in-school transmissions on K through 12. That's important to show that our mitigation strategies are working. We're going to compile that data. We're looking at about October 15th as sort of our 6-week cutoff to compile that data and push that up to, KDHE and the local health officers throughout the state to show what we're doing, what we've done, its effectiveness. If it continues in this effective manner, we're going to ask for potentially some changes if we can get them.
Acceptable alternatives.
Yes, some more acceptable alternatives with respect to quarantine, which will make a lot of people happy. We have to continue on our path, though. If we stray from our current mitigation strategy, if we stray from what we're doing in the community, if we stray from testing when we're sick, it skews the data. And if we don't have a good data set that we can present, we can't make changes. And so this is, we're asking the whole community's help in doing this right, because we have proven here, in our minds anyway,
And the minds of our superintendent.
well, and yeah, absolutely, that what we're doing is working. And the mitigation strategies have helped with overall decreasing our case number from the very beginning. And so that's good. Now we're over 1,000 cases since we started this. Not since we started, but since COVID started. That's a big number. But it's not 8,000 or 10,000 like they have in some of these other counties, and it's not the rapid spread, certainly, like they had Johnson, Sedgwick, Wyandotte, Douglas, Ford, Riley even, where they have the other college. And so these strategies are effective. What we're doing in our schools has been very effective. We need the community to help us stay on track, stay on focus, continue doing what we're doing so that we can present this and maybe allow us more acceptable alternatives, and specifically that would be K through 12. And that will help. That will help. With our first goal was to keep the kids in school.
To go back to the PSU thing with the testing, so it seems like that K through 12 has got some things in place that's going to track and be able to kind of push kids to, that they'll get tested, that there will be coverage for that. Do you think that that's the case at PSU as well? Like, are there effective mechanisms in place to try and capture the things you're talking about?
So, talked with Taylor Panzer today. She's who they've hired to help manage this crisis, and she's got many other jobs, but right now this is her job. About getting that information out for the testing. They're going to do an additional, and they're all social media, right? I mean, it's all social media blitz stuff. Some additional information next week. She's working with her marketing department and leadership, probably even right now, to start that. They've put out this information before, but highlight and key in on this information so that we can get the students involved in that. Students, instructors, everyone, to get them to do the right thing. So,
But ultimately, they are adults.
Yeah.
And have to make the decision about the choices that they're
we have more control in the K through 12.
Right, yes.
So we just got to get them on board and keep doing what we're doing.
Maybe this will be a question for Janice, I'm not sure, but to follow up from our discussion previously about local, I mean, it kind of leads in, I guess, to the EpiNurse thing of being able to do that locally. What is that process looking like now? Is it more under control? Are we still sending a lot to KDHE?
We're definitely still sending them to KDHE, but we have taken over all the K through 12, both. Well, certainly the isolation, and are we doing the quarantine for K through 12?
As much as we
Yes.
can, I think there was a challenge the other day because of the number of contacts that was that one, so that they were going to need some help with that. But I think, and you might just we talked about it on Friday, but Commissioner Blair, I don't think got a chance to hear it, kind of the changes that our priority
Sure.
list.
So as we had these concerns and some changes, we went back and talked with the EpiNurses and reestablished priority with respect to local management of positive and quarantine cases. And so we have, and really we walked in the room and they were already saying, hey, can we do this? It wasn't necessarily a full direction on our part. It was
For them to do what they want, yeah.
And so we've established 4 priorities. 1A is all K through 12 positives. We will manage locally. 1B is the quarantines, and we're doing that, with the exception of the one case that was fairly challenging. The second priority is the nursing homes, or long-term care facilities. And then the last priority is local community outbreaks in businesses. And then as we're able to capture more after those, then we will. And that's, like I said, Janice is going to talk with you in a little bit about consideration for some more epi nurses. And the more that we can manage this locally, the better our data is, the better we'll be able to manage this. And, you know, we have been successful because we have you guys working with us, we have our team, and then we have the community effort. All are working together. And I will tell you, if you look at the counties throughout the state, you won't find this organization very many places, if any. As we listen to the other health officers talk about it, their communities throughout the state. And so the more that we can do locally, I think the better we will be. And so, again, highest consideration for approving that request to help us do more of that locally. But that's where we're at right now, those 4 priorities. And we would like to add community at large, but we need more help. We need more help.
Oh, one last question, sorry. Quarantine numbers.
Yes.
672.
72.
Oh, yeah, 672.
Still a lot, but
Still a
Yeah.
lot.
Yeah, but
Direct.
it's not 2,000 plus.
Right, it was over
Yeah.
2,000, so.
Right.
So for where we are, 2 weeks ago, we were averaging about 21 new cases a day. Last week, about 15 new cases a day. And as of right now, and this will change from today and tomorrow, about 12 cases per day. So pretty stable compared to last week, and definitely lower than 2 weeks ago.
Good.
Yeah, we'd like to get it to 0. I don't know that we're going to get it to 0, but if we can get it
Well,
to,
we weren't at 0 before
Right.
the outbreak, and we were it was a very green
you're right.
status, even with not having 0 cases. So, I don't think that's our expectation, and we're getting pretty close, because what will make us move from red to yellow or orange on the incidence is if we are, 150, I think is the cutoff.
Yes.
And so so far this week, we're at 163 per 100,000. So we're getting pretty close to being able to get out of the red as far as that goes. And again, that's just one piece of the pie, but, that's what's happening.
Mm-hmm.
That's what's happening.
Well, we're heading the right direction anyway.
We are.
Yeah.
And as important or most important, in our schools, we have maintained a consistent green from the get-go. We've had cases, we've had quarantines, but we haven't had, significant outbreaks or impact on our schools overall. And that's a huge success story.
11 out of 6,000.
Right.
And I mean, that is amazing.
Right.
Yeah. Well, we're grateful for everything you do, leading us through this.
Team effort.
Yeah.
It
Right
is.
back-
It truly has been a team effort.
Right back at you is
Yeah.
what we would say. This doesn't work
No.
if we don't have all the community involvement.
Absolutely, because that is definitely what is happening elsewhere, and it's not good.
Right. Within miles of here.
mm-hmm.
Good.
Anything else?
No.
All right.
All right, thank you very much.
Thank
All
you.
right. Thank you.
We're going to move right into Janice. Would you like to come up, Janice?
Good morning.
Morning, Janice.
They gave me the perfect segue this morning, because the first thing I really wanted to do was to address the community and let them know that we are in this together. This is not going to go away soon. And when this is over, we want our businesses to be thriving. We want our community back to the pre-COVID state that we had before. But to do that, we have to follow the guidelines that our health officers have set forth. And I think they've been as lenient as possible. And, we at the health department are there, and each case is assessed individually. There's hours spent on each case. And we need the community's assistance in being truthful with us, and staying home when they're sick. And I know there's fear of loss of pay and that type of thing, but I think there's some help with that as well. But we need the community to help us fight for them, and we need them to be cooperative, be kind, and be truthful. And what we're finding sometimes is people are frustrated and angry. We understand that. And then when as we're going through this in detail, then we're finding, well, the entire truth wasn't told, whether intentionally or, oh, hey, I forgot, but it just lengthens our evaluation of where they should be. And so we need, if we're going to get better and we're doing better, we certainly need community support. And so we're really relying on the community to work with us. So as far as this week is concerned, we've automated our phone system. So if you get some complaints, I understand I don't like automated phone systems either, but it helps us direct our staff a little bit better and take better use of our staff time. We are restructuring the health department, kind of layering some of these off and making the workload a little more evenly distributed. So we are working on that. We lost one epi nurse. She was already, when she came, she'd already applied for another position. It was kind of her dream job, and so, she went ahead and went there. It wasn't that she was unhappy. So we need to replace that epi nurse, number one. And then we also are looking at needing 2 more epi nurses, one for follow-up and one for triage. We're talking about the accuracy of the counts. We are hand counting. We hand count. So we are as accurate as we possibly can do. And, there is that, like Dr. Stebbins mentioned, there is that discrepancy, because what the state wants their data, what they want in their data and what we need in our data, sometimes it's 2 different things. So there is that discrepancy, but we hand count. And so we're really, pretty confident in our numbers. We also are anticipating, that in the winter, we'll wait and see what the winter brings, but if the winter brings more cases, I might even have to come back and ask for more assistance. This week we had one case, 130 contacts. And
Oh my God.
One case, 130 contacts, and that one case took us, we would either have had to close the health department to take care of that, or we could put the contacts to KDHE. So we put the contacts to KDHE is what we did to handle that. So that, to give you an idea, that one case would require about 35 hours of work, one case, okay? So, and it's not a simple, can you ask, yes, it's not a simple yes or no when you're talking to people. You've got to ask them questions, and then they go, well, and it's just not a simple check sheet, it is a long process, and it is challenging for the girls and challenging for the people that have to be interviewed and that, but yeah, this morning, when I got to work, there were 192 faxes of lab work to go through today. Now, we have to enter the positive and the negatives. Even if we have negatives, we still have to enter them into the system. And that's not a 5-minute situation either, because of the speed of the system at the state and different things. We get bumped off, and so our numbers look good. We can't feel it at the health department. We are just really kind of stacked. We have stacks of reports this big, that we're dealing with. So it's a real challenge, and it's very detailed. And So that's why, and then, you know, even when this is over, we have to close every single case out. We're supposed to follow up daily on each, well, forget that, because that we're too overwhelmed to do that, but we do follow up, and that's why we're asking for a follow-up nurse. We're asking for a triage, the one that can triage some of those questions, so the others can go ahead and keep entering their data and making the phone calls and interviewing people and that type of thing. So that's what we're asking for.
Janice,
Yes.
is there any way, and I don't know if it's possible or not, but to utilize the Pitt State nursing students?
I did talk to Pitt State this week, and because they are gearing for a virtual school for next semester, they put all of their clinical up front, and they're packed with that. However, when we get into the vaccination, the mass vaccination that we'll be doing, they will be there. So, yeah, they just can't right now, but they will be there for the mass vaccination piece. And so, yeah, we're working on that, so,
So
okay?
PSU will be virtual in the spring?
That's my understanding.
I had not heard that.
Okay,
I
well,
don't think.
that's
I think they're trying to get all of their clinicals done up front in case they have to go virtual.
In case.
There is a virtual consideration for the spring, depending on how things are going. You know, there's a concern through the winter time that we'll have a resurgence or worsening, the second wave of COVID added with flu, which is going to challenge things. And so they're looking forward, or they're trying to be ahead of the game, I guess is what they're saying. But they haven't made the final determination that they're going to go.
Thanks for the clarification.
Yeah.
Okay, all right. So I'd like to stop right there and ask you if I have permission to hire, actually it's 3 because we lost 1, and then 2 other epi nurses.
So what does the current situation look like with the epi nurses? Because I know some of them are also in charge of like grant programs. So like, are they involved still in this, or like what is?
That's why we've restructured, you know, and
So what does that look like? What does the current structure look like?
the revised structure is that we have those that can still, I have a whole diagram and I left that. I don't think I have it on me, but I have 4 leaders, and under them we have 22 grants. So I have 4 leaders, and under them they're structured with certain grants. And then over here we have the COVID nurse lead person, and she's in charge of that. They had epi that they were doing besides COVID, all the tick diseases and hepatitis and whatever else came through. They were also doing that. I've taken that away and put it over on, you know, someone else. So they just deal with COVID now.
So how many people are solely over in that column?
Right now we have 4. We did have 5, but we lost the 1.
Right,
Okay, so we're down to 4. Okay,
gotcha.
okay.
And so they are, like you said, we're not really doing the, which part, the follow-up and the day-to-day?
We're still doing follow-up, but it would, you know, it would relieve us a lot if we could have just one nurse sit there and do the follow-up on there. They can make
Right.
all the, how are you today? Okay, do you have a fever? Do you have,
Correct.
and document that. So
Right.
if I could have one nurse do that, and then that leaves the other nurses to do the interviews, put the information in the system, that type of thing.
So you mentioned triage. What would that entail?
Oh, well, it's questions like, oh, hey, I was in contact of a contact, and what do I need to do? Or I was in contact at such and such time, or, you know, is this considered, am I exposed or am I not exposed? Or there's like 6 million questions that come in.
Right, so kind
you
of
know?
the Q&A person.
Yeah, it's kind of
The word
FAQs.
triage in a medical setting makes me think of like, I guess doing the contact tracing
Then
work.
they do decide maybe, hey, this one needs to go to.
This one needs to
the
go to this
epi
epi nurse.
this
We have the,
one present.
we have the epi nurses assigned to schools. And so, you know, we got a school calling us, they go to one epi nurse, you know, so that communication line is always there. And And the other issue that we have not even addressed is that KDHE was doing the positive long-term care facilities. They bounced them back to us now. So we're going to be doing those as well. Okay.
Well, do we have, I guess, a cost and a timeline would be the main.
I could do the math really quick. They would like a contract.
So they would also be contract?
They would be contract. We would just do them under contract. I'd hope that there would be funding there through the Spark money.
Well, regardless, I think that if you need them, we'll find a way
You
to
know, so,
take care of it.
okay.
So as far as I'm concerned, if you need them,
Okay, we'll go. The unfortunate part about all that is that it almost takes a whole month to get somebody in because you've got to advertise and then they've got to give 2 weeks'
Right.
notice and, you know, so that,
Yeah,
This
what are
one.
you looking at for the contract time for those?
As far as how long the contract is?
Right, so that they have an idea what they've got a budget.
You know?
So you're looking at a
Right.
3-month or a 6-month probably?
You know, well, I think we got funding at least to the end of the year, is my understanding, and then from there, we'd have to go back and take a look of what we can afford at that
Right.
point in time, okay?
Were there applicants from the, wait, look, see if there's applicants from the first round when we hired the others that maybe didn't get the position?
We have a few, I think, you know, but again, I think some of those have kind of gone on to other positions right now, so we probably have to re-advertise.
That's fine. So
you know,
sooner the
so-
better.
Yeah, the sooner the
Yeah.
better, and when I
Sure.
find I got a really good one, then I'm just gonna grab them and say, hey, let's go, you know.
If we can consider that for more like a 6-month approach, the reason why I say that is that'll get PSU back in the winter, in January, through to their spring break time, when they'll do like they did this semester. In November, they're sending everybody home. I anticipate they're gonna do a similar thing in April, so that gets us through that, you know, October, November, December, January, February, March, at least, so that we can have some stability in that and keep those programs going, so she can manage the things that she needs to manage both in the health department and with the COVID side. So if you consider that
6-month contract.
6-month contract.
3-month through the end of the year, I think that would benefit our community overall.
right?
Well, and if you're looking for a job and it's like 3 months or even 6 months, it's like, well, I don't want to be out looking for another job in 6 months. So that's part of
Right.
our, you know, issue
Sure.
with finding, you know,
All
nursing.
right.
So, okay?
I think we'd be fine with 6 months.
Yeah, but are we gonna
Okay.
give that same contract to the ones that already signed on? I'd hate to, I mean,
Right,
is that
that's-
what you're suggesting? Everyone we have now plus the additional
Yes.
2 or
Of
3
extending
you
to
got?
More
Right.
additional ones.
Okay,
Yeah,
okay.
If we could move that through, that just gives her some stability. And then, you know, if we find that we are in the second wave in December, you know, it gives you guys time to look at it and say, okay, let's work on extending this if we need to, or what direction we're gonna go from there. Or if, you know, if there's other changes at that time, potentially, you know, we can evaluate that. But that gives us a good crossover, good forward-looking management, and may help us hire some nurses versus a 3-month contract's gonna be hard to sell.
Right.
Do you know how KDHE, when they've filled this need, how are they paying for it? I mean, obviously, they've hired a tons of staff to deal with
Yeah,
this.
yeah. I don't know.
I assume
Is
it's
it-
Spark.
I was just curious if there's another avenue out there that we're not aware of. I mean, because,
You know, the next round of funding is, you know, as they keep talking about this, whatever they name the act, is for medical systems and governments, entities to manage this going forward. And so, very likely that will, I would assume will go through, who knows on the government, but that would very likely allow you an avenue to cover the cost of that. And certainly you're covered if there's leftover spark money through the end of the year.
Right.
But it will allow us to go forward further. And then you might actually, if that funding is available, I would ask you actually to consider a year, so the full 2021,
Right.
for a couple of reasons. One, to help her manage the epi, but you could turn those nurses over to the vaccination side when if our numbers are dwindling, so we can do the community vaccination process. And so that it would be dual-hatted and beneficial to our community overall in multiple aspects, so.
Okay.
Do you agree with that, Jan?
Yes,
Okay.
absolutely.
All right.
Okay, go for that.
I guess go ahead and post them then?
Yeah, do what you have to do.
Okay, okay, we'll do that. I'll get this over here in just a little bit. Okay, the next thing I wanted to talk to you about is the ELC grant that we had. We got $300,000 for some case management, and then we had another pocket of $474,000 for some testing. So in the ELC grant, there was, money was received to hire 5 case managers. 5 case managers would be bilingual. They'd be working with the individuals that have having some challenges with isolation, quarantine, food or whatever they needed. Not to purchase the food, but kind of see that they make arrangements for them and that type of thing. We would probably work really strongly with the school systems with this person as well. It also has funding for 1 data person, 1 clerical person, 1 RN, and 1 coordinator in it. So I would like to go ahead and get that started. So the goal of this is to get out and get about 20% of the population tested. And so I'd like to go ahead and post these positions as well, with your approval.
Could you say those again? The
5
positions?
case managers,
Mhm.
1 data person, 1 clerical person, 1 RN, and 1 coordinator.
So 9 people total.
Yes. So that's like 12 additional people, which also might bring me to another issue, and that's room.
That's what I was wondering.
Yeah.
But,
That's fair.
I'm trying to decide if I want to go into the tornado room or not yet, and I don't know that communication would be difficult with concrete walls and things like that. So, it's a possibility that we may be looking at renting a trailer or something like that. So, right now, I really like my epi nurses really close to me, because those trips are 100 times a day.
Making them frequently.
Yes, I make them,
Yes.
yes, you make those frequently, so,
Okay.
okay.
What kind of space would you need? I mean,
We looked at the sheriff had me look at the mobile command center yesterday, and we figure that we probably could put 5 in there if we try to utilize it. But I think the phone lines was kind of did you say it was 3? Yeah, 2 or 3, and we're looking at probably 6.
Mike?
And of course, I can't influence, but with all the folks working from home, I know there would be room at Greenbush with all the telecommunications.
Okay, that'd be good to know.
And to call John State, and that would be another option.
Okay.
As a community partner, I know that Greenbush would want to step up if there's not room in the command center, but all the technology would be there, all the office space, it would be ready to go.
Because these people wouldn't necessarily need to be like with the proximity of like the ones that are doing the contact tracing.
These would not, they've still, would, if that is generous of Greenbush, and I think, if we need to, we're certainly going to be calling on them. The thing is, it's a little hard to manage that in the beginning. I think once we got it maintained and up and running, I think that might be a better solution, but, there's all that communication and
Right.
that has to go on when you start a program, so.
Sure.
But I think it was up and running, or maybe we can look at switching something else that's already up and running over that
I was
direction.
gonna say if there was someone else.
Yeah, we appreciate
If I was
that.
concerned about 9 miles or 4 miles, but with all the telecommunications quick. So, all the video,
Yeah.
research.
Mm-hmm.
It may work, I mean, I think, I appreciate that, that just, yeah, appreciate that. Okay, do I have that, we're ready to go?
Is this so will this be an ongoing program?
This is for 2 years,
2 years?
yes, November of 2022. Okay?
And that's both of those, the 300 and the 477?
Yes, that's, yes.
On the testing portion, is it solely for COVID, or will that also cover for like flu and?
Yeah, I think it's
other-
just standard to do COVID, flu, and strep. It's just standard
Gotcha.
medical.
Okay.
Okay,
Okay.
okay, that's all I have today.
Thanks, Janice.
All right,
Thanks, Janice.
Okay. I guess we can move through. Sure, Mike, you can go.
The other thought on that Green Bush solution would be the interface with other programs like infant toddler programs, interpreters. We're probably serving the same clientele, just to streamline that. Although I know geography is always an issue. Spark, we received final approval from the state. Not 30 minutes after we had talked about sending out the MOUs. All the MOUs are out to those who are going to be receiving funding. As those recipients sign the DocuSign, they go to Bruce, and that is where the bottleneck is. So as soon as Bruce signs, we process those, and we are already receiving receipts from folks who are required. The state, as you know, has changed the formats of reporting, continue to change that. I think we're in our 4th different version. So the only challenge we've had is that from the time that folks submitted applications to the MOU, some of the categories have changed a little bit, and if they are not receiving full funding, there's that question, gee, I requested 100,000, I'm getting 50, so what didn't get funded? But our staff is working through that on a case-by-case basis. All in all, I think it's really going well. The commission continues to receive some really nice compliments on Spark and the wide range of folks that are getting funded. In fact, I did receive one call that just had accolades on the commission. I confirmed it was Crawford County. I thought they may have been referring to another commission, but it was in fact you.
Thanks.
So I have nothing but good news, and it's just rats and cats right now. So we're going to start processing money very, very quickly. If you get phone calls, let me know, and we'll just go from there. Any questions? If you had any questions or concerns?
I had a phone call this morning, and it was from a church.
I'm going to follow up.
Okay, thank you.
And not with the specific, Jim kind of let me know, that's a rat and a cat. If it's a move category, we'll do that, or we'll keep them where they are. It should not be an issue.
Okay, thank you.
You bet. And if you get those calls, just forward those to me. And again, we're going to give Bruce's email a workout, because there are a lot of them.
There's a lot.
There are a lot of them.
See, this is my inbox here, they're starting to put in there.
Absolutely.
Seeing a pattern.
But the good news is, it's kind of like a stimulus check. Your name will be on it. So, good deal. Anything else?
I
Okay.
think so.
Thank you.
And if I need to reach out to Greenbush on that office space for a couple of years, I bet they could work it out. So, all right?
Yeah.
Awesome.
You bet.
We
See you
appreciate
later.
the
Thanks,
offer.
Mike.
You bet.
Yeah.
Bye-bye.
All right. Sheriff? No? Randy? Okay, I guess we'll move on to new business. Don?
Yeah, I might just say a couple of things, like,
Okay.
as we're started training. We did our training yesterday for election workers for the City of Pittsburgh election. And, you know, as you go through that, you talk to people and you get you know, feedback from folks in the community. Anyway, just want to emphasize to the public, we have caught up on our advanced ballot applications for the general election. We've got everything that we were kind of backlogged because we had people sending in for both elections and we couldn't really enter the ones for the general until the primary was over. So we had a copy paper box, a couple full. It's, you know, kind of sounded like some of the stuff Janice was talking about on their forms for contact tracing. So anyway, we've got those caught up, so people we've gotten a lot of phone calls, and that's fine. We encourage that if people are unsure about whether or not they have a request for an advanced ballot by mail into our office. Call our office, that's great, but they can also go to the voteks.org. Basically, it's the Kansas Secretary of State's office, voteks.org. They can look up their voter information there.
So that is an accurate.
There's
Sorry.
a couple of websites. There's a nonpartisan website called ksvotes.org that is really good about getting us new voter registrations and advanced ballot applications. But there is the voteks.org that belongs to the Secretary of State of Kansas. And it has, you can also look up your current voter registration information there as you can on the ksvotes.org. But you can also look and see, it'll tell you if you drill down into it far enough, if you have an advanced ballot application in process that is on file for you for this election. So it can do that, as well as this morning we loaded up all of our sample ballots on there, so a person can go into their information and click on, they want to look at a sample ballot for the general election if they have questions about that. So there's some more information there available because it is through the state and it taps into our voter registration information that's out there on the state's system. So I just want to kind of make sure we'll be publicizing that more and trying to make sure that we've got links to that. We do have links to that on our Facebook page, Crawford County Elections Facebook page, as well as the website, our Crawford County website. But we're trying to get that out as well to the media to make sure people are aware of that, where they can go and kind of look up some of that information on their own if they want to. A lot of people prefer that. They hesitate to call, and we just want to make sure they know that's available, and also to kind of reiterate that we will have, you know, as we send out advanced ballots. I think when we caught up, we were a little north of 4,000 advanced ballot application requests for the general, which is a little over double what we usually do. But we will, and I'm sure we are getting more every day, but as we send those out, we'll have a separate little notification in there to kind of re-emphasize to people the alternative ways they have to get a ballot back to us. I mean, obviously it's got an envelope in there that's ready to go into the mail stream. And to make sure that they sign and put their address in on the back of that envelope before they seal it up. But they can, you know, besides being able to use the mail stream, all of our polling places are required to take those by mail. I mean, if people bring those to our polling places on election day, they can just drop it to somebody there, you know, close to the door, hand it to them, because we want them to hand it to them because those people are instructed to ask them, are they sure they've signed the back of that envelope before they get away from them? Because we want to make sure it's signed so we can count it. Then, besides being able to take it to those polling places, we'll have those 2 drop boxes available, one here at the courthouse in Girard and one at the Judicial Center in Pittsburgh. So, like I said, we want people to know now, because some people may be uncomfortable filing that form for a ballot by mail because they're not sure of how they're going to get it back. They may be a little hesitant to do that. But there are other ways. We want to make that known. But as we mail them out, we'll also make sure that those people that get a ballot by mail know how there are 3 or 4 ways I can get that back to the clerk's office. And some of them are more direct than others. So anyway, just wanted to kind of, as you go through your training and talk to your poll workers and folks that are just, folks out in the community, and you understand more of the questions, I guess, that come up to them or to their neighbors or whoever out in the community. But just wanted to kind of reiterate that. And if you guys have any questions, you can always call us. But people out there in the community, we welcome those calls as well. So,
All right, thank you.
Thanks, Don.
thank you.
Jim?
Yes. My only business is to request a couple of executive sessions, and one would be 15 minutes under attorney-client privilege, commissioners and myself, regarding landfill negotiations. Then a second one would be 15 minutes under non-elected personnel to discuss an employee evaluation. That's all I have.
Okay. Tom?
No, sir.
Jeremy?
I have none.
The only thing, and I don't know, I think I pretty much gave Dale direction to contact the road foremans as far regarding striping, so they could get a mileage count, get a cost estimate figured up, and then we'll have to see how much that cost estimate comes in at. So he should be contacting your foremans and see
Yeah.
what areas need to be done. From what I understand, the smoke sealed portion, 2 weeks after it's completed, they can stripe it. So
I
we'll
had
plan
a
on doing
call
that.
the other day from a gentleman wanting to commend our road crews on what a fine job they did on that smoke seal.
Thank you. Looks good.
So, yeah, hats off to the guys.
So he said it had to be 2 weeks after, and they've smoke sealed everything, I believe, right now.
I think so.
So 2 weeks, and he said he probably wouldn't get them within 2 weeks. So it's probably gonna be 3 weeks realistically.
Kind of depends
3,
on
4.
when they're coming through town.
Yeah, it depends on their schedule too, but it sounded like 3 to 4 weeks they would be in this area. No, that's one of the reasons we did it that way, is so we could stripe it and not just waste the. If you stripe the chip and seal, it doesn't last. You get to redo it the next year anyway. We're hoping this lasts from the get go. Yep. And then I told him, basically looked at the chip and sealed areas from last year, and anything we smoke sealed this year, and hopefully it's
Try to get it done.
not enough going on. But so I guess we'll evaluate that after he gets a number of miles and a cost to us. But 4 weeks hopefully. I think that's all I had for new business. Old business, Don?
I have none, sir.
Jim?
I just want to say that Janice would like to speak.
Yeah, you bet. Yeah, you can interrupt us. I'm sorry. I thought you were just hanging out here for fun.
Nothing else to do. And I know I asked for the epi nurses. I would like to have a little leeway that maybe I could use some contact tracers that would help with the budget a little bit on that. So we might advertise for some epi and contact, versus being the same amount of people, but maybe a little less in the pocketbook, if that's,
Whatever.
Yeah, I
Okay.
think whatever you
Whatever you
deem
think.
necessary, Janice.
okay. We'll
Is
see
the route
what we
we'll
can
go.
get. I'll work with Samantha getting those posted and
Okay.
everything then, so,
Yeah.
okay.
Thank you very much.
Thanks.
Do you have old? No? Tom?
No, sir.
Jeremy?
I have none.
My old business, Jim hit. So I guess we'll start with,
15,
yeah,
Mr. Chairman, I move we go into executive session for 15 minutes under attorney-client privilege, 3 commissioners, counsel pertaining to landfill.
landfill negotiations. I'll second.
Aye.
Right.
Okay, there we go.
Mr. Chairman, I move we go in executive session for 15 minutes under non-elected personnel, the 3 commissioners and council
Second.
pertaining to evaluations.
I guess future business, September 29th, 8:30 a.m. work session, review and sign September bills and payroll vouchers. Also on 29th, Mr. Mackia, Community Corrections Administrative Director, presenting Community Corrections fiscal year 2021 carryover reimbursement budget and the fiscal year 2020 Community Corrections Outcomes Report. October 6th, the City of Pittsburgh special question election will be held with all 4 polling sites in Pittsburgh open from 7 a.m. to 7 p.m. On October 12th, the courthouse will be closed in observance of the Columbus Day holiday. That's a Monday. Any other business?
Chairman, if there's no further business, I move we adjourn.